Good afternoon, everyone, and welcome back. We know there's been a lot going on over the last few days, but right now we're going to focus on the coronavirus as it is still a threat to everyone and poses a significant public health risk. We do have updates on our numbers, which will be given in just a few minutes by Supervisor Fletcher and Dr. Wooten. Today is the start of a new month, and we wanted to remind people that we will see some changes for the better starting tomorrow morning. As we previewed last week, tomorrow we'll be allowing passive activities at the beaches. This includes sitting on the sand and hanging out so long as groups stay within their household units, social distance, and other non-family members, and wear facial coverings. We have worked on this passive reopening with our coastal cities, but please check with your jurisdiction on the opening of your particular beach. We're taking this action as we continue to carefully move to resume all aspects of civic life in San Diego. We are still awaiting state guidance on how we move further into stage 3 that would allow us to open up more businesses and activities. We hope to do that soon, but we're not quite there yet, and we ask for you just to be a little bit more patient over the next few days. Until then, it remains critical to continue practicing social distancing, good hygiene, and wearing facial coverings whenever you're near other people. With that, let me go ahead and introduce Supervisor Fletcher for the numbers.
Thank you, Supervisor Cox, and good afternoon. Before we get into our updates on the state and our current status around coronavirus, I'd be remiss if I did not briefly address the issue that is top of mind for so many San Diegans, and that is that all of our communities have been hurting due to the global pandemic and its impact on San Diego, but it is clear that is not the only pain that is present in our communities. This weekend showed that the pain is much deeper and it goes much further, particularly in the Black communities. This pain is real, it is genuine, and it deserves not only our support, but our actions to address the systemic problems that have caused it. The anger and impatience that so many people feel is justified, and it's not just about George Floyd, or it's not just about a young man in La Mesa. It is about a systematic racism that has been baked into our society from its founding. For those who are in pain, who are outraged, who are hurting, I hear you, I see you. I cannot begin to understand all of the pain, but I can appreciate it. As a father, I can appreciate the fear of losing a child. As a human, I can appreciate the fear of losing anyone unnecessarily. I can also attest to the gross inequities that plague our country today, and I can understand your basic desire for fairness. At the end of the day, that's what this is about, the desire to be treated fairly, to be treated equally. This is not a time for lip service. We can't continue to wait. We need actions, and things need to change. We have seen these inequities and systematic racism in policies, whether it's redlining, whether it's underlying health conditions inequities, whether it's environmental justice communities, access to capital, or use of force policies. And for decades, we have failed to address deep-seated wounds. We have failed to uplift voices, and we have continued to try to sweep our nation's original sin under the rug. And the simple reality is that cannot continue anymore. We didn't just see this hurt and pain in San Diego, we saw it throughout California, and we see it throughout the country. In San Diego, I celebrate your right to peacefully protest. I celebrate your right to make your voice heard, to be clear that systematic and structural racism must end and that real change is needed. That is a voice that needs to be loud and it needs to be clear, but we cannot let our anger or our hurt turn into violent actions that distract us from the goal of advancing the cause of justice. We cannot let a few distract from the importance of what is at stake. I applaud the fire that burns within those who are peacefully protesting, a fire fueled by injustice, an internal fire that can light the path to a more perfect union, but that internal fire, present in so many, should be the only fire that burns in our region. I need you, we need your voices to hold us accountable, to continue to push for actions, and I ask you to channel your frustration into the goal for meaningful structural change, and I pledge to stand beside you, using my privilege and position to empower and uplift and join with you in these efforts. And it's my hope that as a region, we can move forward on that path to a more perfect union. With that having been said, we will move into coronavirus. Governor Gavin Newsom applauded the tremendous progress communities have made at the end of last week and made an additional step forward in terms of local control. We've reached a point in the pandemic where, as the governor outlined, the state of California will dictate how entities will open back up and leave the responsibility to county public health officers about when they should open back up. Thanks to San Diegans' attention to stay-at-home orders, thanks to the tremendous community collaboration and support we've seen, we have slowed the spread. Our hospital systems have been able to increase the capacity and have in surge planning around beds, PPEs, ventilators. We've significantly increased our testing capacity along with our tracing and treatment capacity. And throughout the duration, including the recent weeks of reopening, our numbers have remained relatively steady, and that has allowed us to continue the process of reopening businesses and recreational space. Again, last week, the governor outlined stage 3 entities will be those that the state will provide the guidance about how they can open. Once that guidance for each entity is provided, it will be up to local counties and their public health officers to determine when those entities can begin. The numbers show that our early response is deserving of greater local control, and now the responsibility moving forward will lie with each and every one of us to ensure that we have a smooth and steady recovery. I'd like to briefly talk about those things that are presently open in San Diego County and then those things that we believe are coming in the near future. Starting with those things that are open, obviously essential businesses, grocery stores, pharmacies, gas stations. The reopened businesses include things like retail and mall, swap meets, manufacturing and logistics, retailers, offices with telework when possible, car washes, pet grooming, residential services, dine-in restaurants, and hair salons and barbershops. We've also seen significant progress on outdoor parks and recreation, both in our beaches, which Supervisor Cox just alluded to, camping and parks, and of course places of worship are allowed to be open, provided they do not exceed 100 attendees or 25% of the capacity, whichever is lower. Statewide, the following are still closed: bars and nightclubs, entertainment venues, gyms and fitness studios, public events and gatherings, convention centers, nail salons, and mass gatherings. Some of these will be in stage 4, as the governor has alluded to. A number of them we expect will be in stage 3, and we will stand by for the state to put out new guidance on new industries. Once that guidance is received, that will outline the how, and then our local county policies and public health officer will outline the when. But again, to reiterate, our ability to continue to move forward is predicated on our ability to continue to have widespread cooperation and continue to slow the spread of the coronavirus. And so for all of the San Diegans that are daily taking action, we thank you and we appreciate you, and we will need your ongoing efforts and commitment as we move forward. We'll now jump into our charts for today. Testing, as is common on Mondays, is down a little bit, 3,655, a little bit below our 7-day average. Contact tracing, 384. We continue to make progress towards our goal there, along with our investigations performed now over 9,000. Our treatment in public health motel rooms remains available and presently utilized by 107 individuals. Today we're reporting 73 new positive tests out of the 3,655 for a 2% average. Our rolling 14-day average is 2.9%, and so this is certainly trending in a good direction. Our daily hospital census has our total COVID-related hospitalizations holding steady. ICU numbers down a little bit, non-ICU up a little bit, but holding steady there just shy of the 400 mark, which has been generally consistent over the course of the last month or so. Next, you can see our COVID hospitalizations at the bottom, non-COVID hospitalizations at the top. Again, they're holding steady just under the 4,000 number, and above that you can see the 80% bed capacity reserved for COVID. Final slide here is our ICU utilization. You can see our COVID-related ICUs holding generally steady. Non-COVID dropped a little bit yesterday to today, bringing the percentage of ICU beds occupied down a little bit. These and other metrics are ones that we monitor in real time every single day as we assess our ability to continue what has thus far been a very successful reopening. I'll now turn it over to Dr. Wilma Wooten for a Public Health Officer's report.
Good afternoon, everyone, and thank you, Supervisor Fletcher. As everyone now knows, our COVID-19 update of global, national, and state statistics are based on the data that we obtained from the Johns Hopkins dashboard. And this information was obtained today around noon. Globally, there are over 6.2 million positive cases, including almost 374,000 deaths. Nationwide, the United States is reporting almost 1.8 million positive cases, now at 29% of the global number, and includes over 104,500 deaths. Statewide, California is reporting almost 112,500 positive cases, including 4,176 deaths. Today, the County of San Diego is reporting 7,554 cases, which is 73 more cases than was reported yesterday, and includes 269 deaths, with no new deaths reported since yesterday. The age range remains the same, from 3 months of age to 101 years of age. Of the 3,952 cases in the age group of 20 to 49 years of age, this still makes up 52% of all cases. And also, the gender is evenly split between female and males. And we have only 14 individuals for which no gender information is provided. 1,331, or 18% of cases, have been hospitalized, and this includes 384, or 5% of the total number of cases, admitted to the ICU, and represents 29% of the total number of those hospitalized. The 269 deaths represent approximately 4% of the total number of cases, and of these 269 deaths, 43% are female, 57% are male. 258 had underlying medical conditions, which represents 96% of the total deaths. 10 had no underlying medical conditions, which represents 4% of total deaths, and there is only one case for which information is pending. Regarding race and ethnicity for all deaths, we have data for 99%, which is 266 of the 269 total number of deaths, which means we do not have information for 3 cases. Of this total, 120, or 45%, are white, 110, or 41%, are Latino or Hispanic, 25 or 9% are Asian, 7 or 3% are Black or African American, and 2 or 0.8% are Pacific Islanders, 1 or 0.4% is American Indian, and 1 or 0.4% is of multiple races. Our sincerest sympathies go out to the family and friends of all of the individuals during this pandemic who have been lost to COVID-19. All of our statistics can be found on our county's website, which is at the bottom of most slides that are shown, as well as in the sign in front of me. In regards to reported outbreaks, there are 54 active outbreaks in congregate facilities. 23 are in skilled nursing facilities, and we have a total of 86 skilled nursing facilities in San Diego County. There is 1 new outbreak reported since yesterday, with a total number of skilled nursing facility cases at 783, which is 10% of the total COVID-19 positive cases, and includes 76 deaths. An additional 3 outbreaks are now inactive. Also, we have 31 outbreaks reported in non-skilled nursing facilities, and no outbreaks in this setting have been reported since yesterday, but the total of all outbreaks includes 766 cases, and of this number, 59 deaths are included. An additional 4 outbreaks in this category are now inactive. In addition, there are currently 25 active outbreaks in community settings, with no new outbreaks since yesterday, and all of these outbreaks include 340 cases and 5 deaths. An additional 1 outbreak has been designated as inactive, and 4 outbreaks were previously eliminated due to definition changes. Our testing goal of approximately 5,000 tests per day is well within sight, and we are trending in the right direction with all of our federal and state metrics. We thank everyone for all of the efforts they've conducted to date, and we must continue to be vigilant and maintain strategies to decrease the spread of COVID-19 as we reopen businesses and increase activities. Remember that practicing good hand hygiene and environmental sanitation, practicing social or physical distancing, using a face covering, and conducting screenings where practical are all of great public health importance to prevent the spread of COVID-19. All of these actions count, and each one of us has the power to make a difference. Lastly, tomorrow morning at our Board of Supervisors meeting, I will review or provide an update on all of our metrics, particularly the triggers that we have identified if we need to dial back. Now, please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. Let's go directly to the questions.
Bridget Naso at NBC7, please state your question.
Thank you. Thanks very much. Today, community activists accused local law enforcement of excessive force against protesters this weekend, particularly in La Mesa, where people were shot with rubber bullets. One person, a grandmother, who was shot in the head. They compared the use of force to that was used when people came out to protest COVID-19 restrictions, saying the tactics were different toward those who were protesting racial injustice, noting the use of military-like equipment. They're calling for an investigation. What is your response? And obviously, both groups put their health at risk when they turned out to protest.
Well, I, as an elected official, I think feel the same rage everybody else did when they saw the film of George Floyd and his death in Minneapolis. That's something that is inexcusable. The sheriff is the person that should really respond to law enforcement related issues. He's not here with us, and I would suggest you should probably get a hold of him for a response. Next question.
Steve Walsh at KPBS, please state your question.
Yes, sorry, I'm going to keep going with Bridget's line of questioning. Has there been any sort of coordinated response between the county and the communities? And what are the rules of force when it comes to handling protests?
Well, I think I would refer you to the sheriff. He's the proper law enforcement agent for the county of San Diego. He actually has the 9 contract cities. And I would suggest you should probably get a hold of him. Next question.
I'm sorry, but aren't county leaders aren't they coordinating with the city of San Diego or the state themselves, or if this all is just being done through the sheriff's department but without input?
Well, I think the sheriff has been in contact with the other law enforcement agencies. I think they've had several meetings and are working in a coordinated fashion to try to maintain order in the communities. And obviously, we know people are out there grieving. We understand the concern that has been raised. I think each of the jurisdictions are trying to deal with that issue in their particular way. And at this point, I think it's a matter of letting the people protest in a lawful manner and certainly express their concern, their outrage at what happened in Minneapolis and other areas around the United States. But I think at this point, it's really more of an issue to let the sheriff deal with those other law enforcement agencies and trying to make sure that people can protest in an appropriate manner, but at the same time that we maintain order in the community. Okay, next question.
Paul Sisson at the Union Tribune, please state your question.
Hi, thank you. So I'm interested in numbers that we've seen recently regarding COVID-19. They've been pretty low. It's interesting because we know that the median incubation period for the COVID-2 virus is roughly 5 days, and nearly 98% of cases show up within 12 days of exposure. But as of Sunday, it's been more than a month since beaches have had their reopenings. We've had a week or more pass since casinos, restaurants, and retails have had their limited reopenings. It's been 5 days since barbershops and salons have reopened. Why aren't we, I remember you guys all speculating that we would see an increase in cases when everything reopened and we had more social contact. Why aren't we seeing more cases? Why are cases continuing to go down? What do you make of that?
Well, I'll let Dr. Wooten respond to that. I would hope that maybe some of it is because people are wearing facial coverings, that they're doing appropriate social distancing, but I'll let Dr. Wooten respond.
Thank you for your provocative questions, Paul, as usual. So as we will show tomorrow, and it has been shown in previous epi curves, we peaked, quote unquote, probably the latter part of April. But with that being said, we still have every day from day to day. Yesterday was the lowest number of cases at 75 or 79 more than the prior day. But every day, the numbers, with the exception of that particular situation and maybe one other, are over 100. So we still are having positive cases of COVID-19 in San Diego. And because people are adhering to those 4 strategies that I constantly talk about, hygiene and sanitation, as well as wearing face coverings, and some facilities conduct screenings, as well as social distancing. So that means the public, most of the public, and we know not everyone is adhering to all of those, but a large proportion of the public is adhering to these strategies, and that's what's at least keeping our numbers from skyrocketing. And we just have to be vigilant and continuing to monitor as we now open up restaurants. We really, that happened last week, so monitoring things for the next 14 to 21 days is going to be very crucial.
So I wonder if you're surprised by the trend that you've seen continuing to kind of hover around 100 and sometimes dip below 100. I remember at the beginning of last month, you were predicting that we would, as we reopen things, we would see something like 400 cases a day, right? And we're still kind of in the 100.
I said that if we don't adhere to the strategies, we could see our numbers go up. I typically don't give out numbers like that, and I don't think you could document me saying anything of that nature. What I've said consistently is if we do not stay the course, adhere to the practices and strategies that I've just outlined, we could see our numbers escalate. And thankfully, the public is adhering. Our restaurants are cooperating, and we just have to continue to keep that up, because right now we do not have herd immunity and no vaccine on board currently. It will be sometime probably this time next year, if we have herd immunity, which means that we would have to have gotten, even if a vaccine is developed, it has to get into the arms of people, so people have to want to be vaccinated. So we are just staying the course with the strategies that we are recommending to the general public, and we are thankful that the public is cooperating. Thank you.
Okay, thank you.
Well, that concludes the calls that we have for today. Before we leave, though, I have a couple of updates I wanted to provide you in regards to testing. Last week, we announced some new testing sites. Some of them, like the drive-up testing site at the Aquatica Park in Chula Vista here in South County, have been particularly hard hit by the virus in those communities, and that was certainly a welcome addition to our testing capability. Tomorrow, a new site will open in San Ysidro. This will be at the San Ysidro Civic Center at 212 West Park Avenue, and it'll be open from 7 a.m. to 7 p.m. This is a state testing site, so appointments are required, and you can make one by calling the state at 1-888-634-1123. For access to all testing, you can call the County Public Health Nurse Line by dialing 211 and then selecting your language and pressing 1. We will not be holding a media briefing tomorrow, as we will have a Board of Supervisors meeting. There will be an update on COVID-19 at the meeting presented by our staff. Attendance at our meeting is not allowed at the meeting, but you can go on our county website to watch a video of the meeting and follow if you want to make a comment at the meeting. And for ongoing updates, please log into our coronavirus website for daily updates. You know, just one other comment in regards to some of the things we've seen over these last couple of days. I'm an old white guy, and I can't fully understand the pain and the anxiety that many people in our community have felt over the last few years about racial injustice. But like you, I watched the George Floyd video, and it truly sickened me. I was dismayed and I was outraged by what I saw. But the violence that sometimes precipitates in communities is something that we really don't want to see in this community. Peaceful protests are fine. Certainly getting people to get a good dialogue going and working together to come up with common solutions is what we all should be working on together. Violence is not the answer. It's really the dialogue and the cooperation and the exchange of ideas that's really important. So again, I would urge the protesters to do so, but do so in a orderly manner, to certainly let your sentiments be known to your elected officials and to others. But the violence is something that we really don't want to see in this community. And I certainly call upon all San Diegans to work together to make sure that we can try to solve these problems in a peaceful and a direct manner. With that, we will stand closed until the next briefing, which will be on Wednesday at 2:30. Thank you very much.